We're going to begin with infant safety, topics like sleeping safety, crib safety, vehicle safety, to areas that we really need to keep our baby safe. So let's begin. Your baby is going to spend a lot of time sleeping in the first year of life, and it can be fraught with hazards. We're going to go over some topics and some areas that you can keep your baby safe, specifically designed to talk about sleeping safety and SIDS.
Now, what is SIDS, Maureen?
Well, the goal in talking about sleeping safety is to really reduce the risk of SIDS and suffocation that can occur in the first year of life, in the first 12 months. SIDS specifically is sudden infant death syndrome. It's really an unexpected death in an apparently sleeping child who's less than about a year of age, less than 12 months. Mom puts the baby to bed and comes back and finds the dead child, who really looks like they've not suffered at all.
So is there anything we can do about that?
Well, the cause is undetermined. A lot of times it has been shown to be suffocation, which is what we're going to talk about, some ways to keep your baby safe from it. The peak incidence tends to occur around 2 to 4 months of age. Now, back in 1994, there was a campaign that was started, and it was endorsed by the American Academy of Pediatrics. It was called the Back to Sleep campaign, and it basically told you just that. Put your baby on their back to sleep. Because what they've found is babies that sleep on their tummy are about 13 times more likely to suffer from SIDS. Well, since the campaign that was started in 1994, we've seen the rate of SIDS decrease by about half.
Well,
Specifically,
Maureen and I have been actually practicing emergency medicine for quite some time, and we've seen the change in our practice.
Right. We just don't see that many cases coming into the emergency room anymore. So the reminder is back to sleep. Put your child on their back to sleep when you put them to bed. Now, one reminder is don't put your child on their side, because they can accidentally roll forward, and then you're dealing with a child again who's face down and much more likely to suffocate.
There are things you're going to be tempted to put in your crib with your child that you just shouldn't. Things like pillows, comforters, blankets, stuffed animals, things that were given to you as gifts, or you may even been yours as a child. Things that were actually offered to you as part of your baby shower. They're not things that you really want to put in there, like those baby bumpers that go around the inside of the crib. It's not a very good idea to put those in with your child. In fact, basically, the only thing that should be in your child in the crib is your baby.
Right.
Perhaps in one of those little sleeper jumpers, or in the swaddles, where the baby still is wrapped and comfortable, but is not with any risk with anything around them that might cause suffocation. The other thing is, where should your baby sleep? Honestly, the only place your baby should sleep is in their crib, or in a separate playpen or separate bassinet next to your bedside.
And those are great.
You don't want to put your baby in bed with you. It's tempting. You're tired, you're breastfeeding, you'd like to have the baby right there close. The problem with that, however, is that you may inadvertently roll over and suffocate your own child. Or if you have animals that sleep with you, or your other children sleep with you, the baby needs to be by him or herself in the crib with nothing in there except the baby and something that zips up or wraps around them that's cozy, comfy, that's attached to them, that can't actually wrap around them and cause suffocation.
A few other tips from the SIDS experts. First, offer your baby a pacifier. Pacifiers have been shown to decrease the rate of SIDS. Now, you want to wait until the baby's about 4 weeks of age, especially if you're trying to breastfeed, because it can cause what's called nipple confusion. The baby just can't decide whether to breastfeed or use the pacifier. So just wait until the baby's about 4 weeks of age before you offer the pacifier, but then go ahead and offer it. Make sure that the room the baby is sleeping in is not too hot. Make sure that there's adequate airflow. Nobody should be smoking in the house. So if you have a smoker in the house, make sure they do it outside. If you can breastfeed as long as possible, that's going to be key to really decreasing some SIDS also. It's known to decrease respiratory infections. And we're going to go over some benefits for the mom and the baby in breastfeeding. But the key here in regard to SIDS is really decreasing the number of respiratory infections the baby's going to get in the first year of life. And that's been somewhat linked to rates of SIDS. And lastly, never offer your baby who's less than about a year of age any type of honey. Honey at times can have a toxin in it. That's fine for older children. They're able to handle it no problem. But little babies less than about a year of age, they can get something called botulism. Botulism is a neuromuscular disorder, causes profound weakness and real difficulty breathing. So you just want to avoid honey at all costs in babies less than about a year of age.